My name is Cecile de Miliano and I work for the University of Wageningen together with my colleague Adrian Firth. We have been implementing the survey in SLRC, the first round of the panel survey, which we did in South Kivu, in the east of the Democratic Republic of Congo. Actually, we performed the research last year from between September and December. Within the survey, we focused on three main themes. The first theme was livelihood trajectories, the second was basic services, and the third was perceptions of governance. And specifically within basic services, we looked at health, at water and sanitation, and at education, obviously. For example, if we zoom in on the findings related to health services, first of all, it was interesting to find that, generally speaking, people were fairly satisfied about the services. When, if we look at the assessments done by health professionals, they're generally quite negative, and people were fairly critical towards governance, but that they generally had most confidence in customary levels of governance. So we're talking about local kings, we're talking about head of the village, head of the groupement, which is a set of villages. So generally speaking, the levels of governance that were closer to the people, that's where they had perceived most trust. But then when it comes to really having access or improving basic services, generally speaking, they were more critical towards all levels of governance. The third interesting finding was who they perceived was, for example, managing and running the basic services. And there we see that there's big variety in terms of which service we're talking about. So, for example, education and health were mainly seen to be run by the government and churches or faith-based organizations, which in reality is, especially for faith-based organizations, they play an important role in the east of the country. Whereas, for example, for water, we saw that the majority of the people felt that it was NGOs running that service. Interesting, if we look at, for example, if we zoom in on the findings about health, we see that usually the government isn't always providing it, but it's mainly the faith-based organizations. So it seems to suggest that people are not always exactly clear on who is actually providing the service. So for over 2 years' time, it's hard to say what to expect. At the time when we performed the survey, which was last year between September and December, it was a very unstable moment, politically speaking. So I think if we look in 2 years' time, it's hard to say which direction it will take. For many years, it's been an unstable situation. So, yeah, well, we obviously hope for the best, but I think in realistic terms, it remains to be seen which direction the country will take in terms of stability, which is needed in order to increase people's livelihood and increase the access and quality of basic services.
I am Vishnu Rajupreti from Nepal. I am director of the Nepal Center for Contemporary Research and team leader of the Nepal program of the SLRC. We have conducted the household survey with the 3,175 respondents, and there our main focus was to explore the people's perception on the government, its service provision, and the capacity building role of the international community to the Nepali state and its organization. There are three very interesting findings we observed. One was that against the very popular negative narratives in the societal level at Nepal, the people still very much believe and rely on the service provided by the government. For example, health, education, drinking water, transportation service. People were positive towards these services because in the media it was quite negative. The local government was the most trusted by the people compared to the central government, but interestingly and paradoxically, the local government doesn't exist. Elected local government doesn't exist since 10-11 years. but still the people favor more to the local government because they have the easy access. But the third interesting finding is that comparison between the men and women were less favor to the local government compared to the man, and the reason we were trying to find, and the few of the reasons were: first, women were not engaged in the decision-making process in the local government because they were mere beneficiaries, so they didn't know much. But the male population male representatives were more engaged in this local decision-making affairs, so they were more aware, and therefore they were more favoring to the local government. So these are the very interesting three key findings which we are widely disseminating, debating based on these findings, and further exploring with the qualitative research. As you know, Nepal is in the very critical moment. We are really in the crossroads of the transition. The transition can go to both ways. If our constitution making process goes smoothly, if the political parties are able to settle very thorny issues amicably and include into the constitution, at that time the entire landscape will be changed, and the people will have the more hope with the state. The service delivery system will be improved, and we will be in the very right trajectory, and Nepali people are always hopeful, and in that sense they will be really in the positive part. But if the tension will mount, the constitution will not be able to promulgate. If there are ethnic federalization issues are coming more strongly, and if the federalization is not settled, the form of government is not settled, radical Maoist Communist Party is still opposing the election, and if it obstructs and all these negative things happen, at that time people will be frustrated, because since 16 years Nepal is in critical condition, and if it prolongs, then people will have more frustration. State service delivery capacity will be even obstructed by the other political issue, and at that time the scenario will be quite negative.